You are now live.
Okay, all right. Hello, everybody. Dr. Alex Earl here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. This is the time I get to spend with you guys, and of course, we're gonna go over all your plastic surgery topics and answer all your questions. Okay. I think most of you know me by now. I've been doing this for a long time, but for those that don't, I am a double board certified plastic surgeon, which means I am board certified in both general surgery and plastic surgery. Okay. So I pretty much know everything from head to toe. So I'm happy to answer all your questions, and you know that it's coming from a reliable source. Okay. But today, I wanted to start off by addressing a very, very common question that keeps coming up over and over and over and over again. All right. And I always have the same answer. But honestly, it's a little frustrating because it just keeps coming up, and we talk about it, we put it on our videos, we put it. I do posts about it, educational posts in the group. But I think one of the reasons why it keeps coming up is because there's a little bit of controversy out there. Perhaps other surgeons are telling you something different. Okay. So I'm just gonna go get into it, and I'm gonna explain the reasons why. And I hope that after that you can really come to an understanding, okay, as to why it's better to do things in a certain order, and kind of put this puppy to bed, okay? So what we're talking about is the question, the never-ending question, okay? Is it better to do your tummy tuck or your BBL first? Okay, that question comes up all the time. All right. Of course, these are for patients that have a certain amount of loose skin or skin laxity, okay? But honestly, here in the US, our patient population, those that are coming in for liposuction or BBL, I would say probably 80% or so do have some degree of skin laxity. Why? Because they've had either prior pregnancies, one or multiple, or they've had some weight loss issues, or maybe they were smokers in the past, or some damage, or then of course there's always genetics, which is something that you can't do anything about. But for the most part, I would say the overwhelming majority of patients that come in will have some degree of skin laxity. Okay, and so then therefore the question comes, what should we do first? And unfortunately, for one reason or another, a lot of patients want to believe, or they want to try to do their BBL first. Okay. And I always say it is best for the long-term outcomes to do your tummy tuck first. Okay. Why is that? So when you do your BBL, which actually what we're really talking about is the lipo portion, so your lipo 360. When you do your lipo 360 BBL in a patient that has loose skin laxity, poor skin elasticity, okay, a few things are going to happen, all right? Especially if they have what I would call moderate to severe skin laxity. If you have moderate to severe skin laxity, the chances of all these things are going to be much, much higher. Doesn't matter, how consistent you were with your post-op care, your massages, your faja, etc. Okay, there's nothing that you can do about your skin. Once you're on your OR table, whatever's happened to that skin has already happened. You either had your pregnancies, your massive weight loss, your sun damage, your smoking, and of course your genetics. You can't change any of that, and unfortunately, I can't change it either. Okay, and so when you do a liposuction after that, what ends up happening is that skin does not retract well. There's areas of that skin that may retract better than others, and that leads to lumpy, bumpy looking abdomens, uneven looking abdomens, okay? Areas of loose skin. And so what you typically see, especially kind of around and below the belly button, is you definitely see some unevenness there. You may see some hooding over the belly button, okay? Because there's some loose skin above the belly button that kind of hoods over it, and the belly button's a fixed point in the middle of the abdomen, okay? And so you're gonna have increased chances of unevenness, okay? You're gonna have increased chances of inflammation and fibrosis. When you have skin that kind of folds upon itself, that increases inflammation, increases risk of fluid retention and seromas, which then become more permanent scarring and fibrosis. So chances of scarring, inflammation, and fibrosis are going to be higher, okay? The other thing that you're doing when you do that liposuction, of course, there's going to be inflammation, again, a certain degree of scarring, and that's going to cause the skin to be tight and not as, kind of stretchy when you try to pull it down for your tummy tuck, which means that there's less skin that can be removed, and a higher chance you may end up with that little kind of vertical incision in that mid-lower belly as well, okay? So yeah, it's a lot harder to pull that skin down when you do the liposuction first, all right? And then, because you've had the liposuction, because of course, when you're using the cannula, there's gonna be some degree of taking out some of the blood vessels in there. The chances of having a vascular issue, meaning that the skin dying after you do a tummy tuck, are also a lot higher. Okay, so for all these reasons, I don't think that the BBL should be done first. Okay, it's actually a disservice because you do the BBL first. You have these uneven areas, and then even when you do the tummy tuck, some of that unevenness may remain. Makes it a lot tougher surgery. Now, so why do people then? Why is there so much resistance? I think there's a lot of resistance out there because there are a couple of myths out there. Okay, the first myth. There's people that say that if you do your tummy tuck first, that there's not going to be enough fat. That is a complete myth. Okay. In my entire career, I've been here in private practice for about 5 years. I've done, I do about 1,000 to 1,200 cases a year. So you do the math, okay? And I have never had not a one single case where I've done the tummy tuck first and then not had enough fat for the BBL. Zero. It's never happened, okay? Why? Because when you do a tummy tuck, you're just doing some limited liposuction to the flanks and the waist. You're only taking out about 1 liter max, which is the legal limit here in Florida. And you still haven't touched the central belly. You haven't touched the rest of the flanks. You haven't touched this area over here. You haven't touched the back at all, okay? And if you needed to, you can always go to the arms and the thighs as well. So it's not a problem. Do not believe this myth. Total myth, okay? You will have enough fat, all right? But what I have seen is the opposite. And I see it all the time. A patient will come in. I say, I truly recommend that you do your tummy tuck first. And they're like, no, doc, I don't know about the scar. I'm not sure if I have enough fat. I really want to try to do this first. And I say, well, you do have some skin laxity. All right. And just know, I'm telling you right off the bat, that if we do the BBL and liposuction, you may end up with lumpy bumpiness and unevenness and loose skin and hooding over your belly button. And if that were to happen, then you're going to need your tummy tuck, and it's going to be a lot harder to do that. And they're like, yeah, doc, let's just do the BBL first. And we do that. Exactly what I said was going to happen happens. Okay. And then we try to go for the tummy tuck, and then there's still areas of inflammation and fibrosis, and there's still some unevenness there, which becomes very hard to deal with. I'm not able to remove as much skin because I can't really stretch it down as much. Okay. And so then it's not like the most ideal result. Okay. The other myth is that, will the skin get loose again? This is the other myth. So you'll hear people there out there saying, well, if I do the tummy tuck first and then I do the liposuction, then will my skin get loose and then I'm going to need another tummy tuck? Again, total myth. Never seen that. Okay? When I do the tummy tuck first, we're able to really stretch down that skin. We get it really, really, really tight. And then after that, even after your lipo 360 and BBL, that skin remains nice and tight because we've removed all that excess skin. Okay? And you can actually, the skin is so tight afterwards that you can do things such as HD, high definition lipo afterwards. All right? So we get that question a lot. Like, can you get high definition lipo after a tummy tuck? And the answer is absolutely yes. And in fact, if you have some loose skin, it is much better to do the tummy tuck first, because before that, you're not even a candidate for HD lipo. One of the main criteria for HD lipo is having good quality or tight skin. But if you do your tummy tuck first, then you become a candidate, and then you can have your HC lipo. Okay, so once again, this is also a myth. In all the cases that I've done, when I've done the tummy tuck first, guess how many cases I had to go back to remove loose skin afterwards after the BBL lipo 360? Once again, 0. Never had to do that. Okay? So I keep insisting. Please, please, please. You want the best result? You want the best long-term result? Do your tummy tuck first. Okay? All right. Happy to answer questions.
Yes. Well, this is a comment. I did just the way you told me, and I have excellent results. Still do.
Awesome. All right.
Yeah,
there you go. Thank you very much. So that's exactly right. If you have the chance and you know you're doing both, tummy tuck should go first, and then you're going to have the best long-term results.
Had a tummy tuck years ago, and last year my gallbladder was removed.
Okay.
It did a number on my tummy tuck. It did a number.
Yeah. Okay. So, sometimes that can happen. I'm not sure whether the gallbladder was removed, laparoscopically or whether they had to open. But sometimes if you do open it, it does require a relatively long incision underneath the rib cage there on the right side. And that could, change things with the tummy tuck. Laparoscopically, it shouldn't change things as much. But again, I would have to kind of study your case to see exactly what happened, to see then if there's something that can be done to kind of help that area once again.
Surgery next month. How can I prepare mentally? My nerves are kicking in.
All right, so that is a great question, and that brings me to basically a new service, or relatively new service that we have here at Pure Plastic Surgery that we're providing to all of our patients. Okay, so surgery is a physical roller coaster, but it's also an emotional roller coaster. Okay, and all of this starts before surgery day. All right. That journey starts at least, probably even before then, but at the very least when you start getting your pre-op kind of call, which is going to be about 60 days before surgery. But it probably even started before then, okay? So what are the things that can be done? Well, number one, of course, I think someone feels better when they get to know, the surgeon. So of course, that's why we do a lot of this on a lot of these videos, a lot of social media, so you can get to know me and feel comfortable with me, okay? The other one is education, right? If you don't know what's going on, then that makes things, more nerve-wracking and you're more scared, all right? So we spend a lot of time on patient education, because I think then when you really know what's going on, when you understand what's happening, when you know what to expect, that also helps calm the nerves, okay? But the third is, just getting some support. And the support you can get, of course, from the office, but you can also get it from groups. So we have a great Facebook group where, a lot of the past, present, and future Earl Pearls are there to help each other out. It's kind of a group support, and that helps a lot. And then last but not least, what we're talking about today, what I was just mentioning, is our partnership with Make It Pop. Okay, Make It Pop is a group that helps support you before, during, and after surgery. Okay. And a lot of what they do is, counseling and emotional support. All right. And this is something that we are providing for all of our patients because of how important it is. They also, help in terms of nutrition. They help in terms of educating you in your post-op care. They talk about massage, about fajas. So they provide a whole bunch of education so that you know exactly what's going on, and so that you feel better about the entire journey. Okay? Because it is a physical and emotional roller coaster that's going to last several months. Okay? And you don't have to do it alone. Okay? We're here for you. All right? Our Facebook group community is here for you. And also, importantly, Make It Pop is here for you as well.
Okay, the next question. How do you feel about the reverse tummy tuck?
Right, so reverse tummy tuck is something that's been popping up more and more lately. And there are some advantages to it. What I would say is that it's not for every patient. It's not like everyone that needs a tummy tuck now can just switch and get a reverse tummy tuck, okay? No, it's for patients that specifically have most of their skin laxity in the upper abdomen. Okay, and so instead of them pulling everything down, you end up pulling everything up. Okay, typically these are patients that have the skin laxity in the upper abdomen, but also they don't have a lot of what we call diastasis or muscle weakness or separation, because you can't really fix that from the bottom up. Okay, that really needs to be done from the top down. Okay, and then the other thing that needs to be accepted, because when you do a reverse tummy tuck, is that the scar pattern, which is placed underneath the breast, is hidden for the most part, while it's underneath the breast, but then it does have to cross the midline. So you will have a scar that comes underneath the breast and then crosses the midline right here in the chest, in the lower chest area, okay, and then crosses, underneath there. And so when you're wearing something low cut, that scar may be visible. All right, as opposed to your tummy tuck scar, which is all the way down here and easy to hide, like in a small bikini or anything else. Okay, so those are all the considerations that need to be taken into place.
I'm getting surgery soon with you, but I'm a little afraid of anesthesia. How can I overcome this or not think too much into it?
Yeah, so I do all my cases under general anesthesia, and the first thing you should know is that it's very, very safe. Okay. General anesthesia today, has, 2023 has made a ton of advances, incredibly safe. And we use providers that have, many, many, many years of experience and have been with us for a long, long time. Okay. So those are all the things that I can say. We do use, what's called a CRNA or nurse anesthetist. They come, we have a team that, that's exclusive with us, meaning that it's always the same team. We don't have like a whole bunch of different people rotating through, so we know exactly who they are, and we know they have great experience, great bedside manner, and they're very, very safe with our patients.
Okay, after lipo, some part of the stomach got lumps and little loose skin. Is that normal? Is anything non-invasive that I can do?
Right, so it depends on the degree, okay? So the lumps can be one or two things. One potentially some fibrosis or scar tissue, or maybe there is just that unevenness because of the loose skin, which is exactly what I'm referring to here. So it's important to make the correct diagnosis, because the solution depends on what that diagnosis is. If it's due to fibrosis and you're under a year, then you can do some non-invasive things such as wood therapy and cavitation, sometimes some RF or ultrasound, therapy as well, and that can help with that fibrosis. Okay. Now, if the lumps or the unevenness is due to loose skin, then the solution is skin tightening. Okay. If it's kind of mild, you can do something like Morpheus 8, which is that microneedling with RF energy. So it's like microneedling on steroids. If it's a little bit more than that, you can sometimes use something like Body Tight. Okay, but if it's moderate to severe, then you do have to think about doing a mini tummy tuck or tummy tuck to get rid of that loose skin, and you kind of end up going in this direction. Okay.
This one, it's for me. It's if can you do an educational video to discuss the reverse tummy tuck? So
yeah,
let's do it, Doc.
Okay, all right. Yeah, we can certainly do that. Yeah, all right. Well, we'll put it on our list. So keep a lookout for that.
Okay, let's go with the next question. What areas are included in a 360 lipo and BBL?
All right. So first of all BBLs come standard with lipo 360. All right. So when someone just says BBL, they don't mean simply the fat transfer. They mean the lipo 360 plus the fat transfer to the buttock and the hips. Okay. So the areas that are typically included with that, with the lipo 360 and the BBL, are essentially the entire trunk. Okay. So that means the entire abdomen. Okay. The flanks and the waist, and essentially the entire back. So pretty high up, from here all the way down. Definitely includes that whole bra line area. And kind of underneath here as well. What it does not include is a buffalo hump, which is all the way up here. So you have a buffalo hump that is additional. All right. And it does not include, of course, other areas such as the chin, the arms, and the lower extremities, the thighs. Okay. One thing that it does include, I forgot to mention, is the suprapubic area. Okay, the mons area. So that is included also in the lipo 360.
Okay, Doc, thank you. And this is for YouTube. This question.
All right, we got one from YouTube.
Yes, we're in
Excellent.
too. Can you get a tummy tuck and a breast reduction at the same time?
Yeah, so definitely. Combining breast and tummy tuck is actually very, very common. Sometimes we just, we call it mommy makeover, but it doesn't mean it's necessarily just for moms, right? But it just means that combination of a breast procedure and your tummy tuck, okay? So that breast procedure can be any breast procedure. It can be a breast augmentation, a breast lift, a breast reduction, breast lift with implant, pretty much any breast procedure, and then your tummy tuck. So definitely can combine them. We do that every day. Okay? All right. Okay, everybody. So please, please, please. I know I'm going to end up talking about this again, in a couple of weeks or actually, no, hopefully a couple months. All right? But the answer to the question, tummy tuck or BBL first, there you go. Do your tummy tuck first. You will have a much better result in the long term. Okay? Okay. All right. Well, I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. Take care. Ciao.